Well, in the last 10 years, I genuinely believe that there's been a revolution in the way that we deliver combat casualty care. And that revolution breaks down into new concepts that we've introduced, new technologies, and a reorganisation of our medical services. And most importantly, it's resulted in a profound improvement in our outcomes from combat casualty care. Yes, I believe there are lessons that we can swipe across from the military setting into the civilian setting, and particularly into our major trauma centres. Again, we can look at the concepts that we've used and we have changed our paradigm from ABC, airway, breathing, circulation, to CABC, where the first C stands for catastrophic hemorrhage. We've made a lot of advances in the way that we deal with massive transfusion. So our most critical patients who have lost a high quantity of blood, we have changed our processes considerably. There are also lessons to learn about how we organise the reception and initial assessment and treatment of the seriously injured patient. What we now do in the field hospital is that we move our most seriously injured patients directly onto the operating theatre. We call this right turn resuscitation, because the configuration of the field hospital means as you come through the front door, you either turn left into the emergency department bay or you turn right into the operating theatre. And then we pull together all of the people that are necessary to resuscitate that most critically injured patient. So the surgical team are scrubbed and ready. We pull in the emergency department team to start the resuscitation. We have the anaesthetist managing the airway, oxygenation, anaesthesia, but also critically managing the coagulopathy, the abnormal blood clotting. And we pull in the consultant radiologist to do a rapid ultrasound of the abdomen to ensure that there is no blood in the abdomen that needs to be rapidly surgically dealt with. If we look into history, every significant conflict there has been substantial advances in medicine. So we can look back to the First World War and see the intervention of preventative health measures, and also the Thomas splint, which reduces mortality from open and fractured femur from 80% down to 20%. We look at the Second World War and we saw the birth of our modern National Blood Service and the introduction of antibiotics. And we have lessons from our current campaigns that must be moved across into civilian practice. So in order for us to do well in the next big campaign, it's absolutely imperative that we now embed these changes into the day-to-day civilian healthcare practice.